Welcome back to Talk to Doc. I'm Dr. Oyi Balburias with Maricel Laksa Pangilinan, of course.
Yes, joining us now is Dr. Dexter Cheng. He's a pediatric cardiologist at the Medical City.
And my classmate as well. So Dex, so let me ask you now the first question. What are the most common heart conditions that you encounter among babies or infants?
The most common heart diseases we encounter is probably in the newborn period, the patent ductus arteriosus. It's a blood vessel in the heart that has not yet closed, but they normally close spontaneously on their own, given a few days or a few weeks. The other one would be a ventricular septal defect, a hole in the lower rooms of the heart, and that one is not an emergency. You can probably just wait and observe, and many of those also close on their own.
And what would be the reason why parents will bring them to you, or why your colleagues or other doctors will refer them to you?
Yeah, the most common reason for a referral to me would probably be because of a murmur, an abnormal heart sound. They notice when they're doing their physical exam, and that's usually the first reasons why we get called into the picture.
We can also differentiate these heart conditions or congenital heart conditions into two subgroups, right? Like what they call, more commonly known as the blue baby. So I think that's also a reason. And the other one is the acyanotic. So cyanotic and acyanotic. So how do we differentiate the two?
All right. Our case today is baby Eder, and her case is the cyanotic heart, the blue baby. That's not very common. And then the other end of the spectrum are the ones that have normal oxygenation, normal color, so the acyanotic. And the two conditions I mentioned earlier, patent ductus arteriosus and ventricular septal defect, are examples of the acyanotic. And those two together account for maybe about 80% of all congenital heart diseases already. So baby Eder's blue baby condition, the transposition of the great artery, is the most common blue baby condition we have worldwide.
So in the case of baby Eder, what makes their heart prone, like, or a baby's heart prone to these conditions that you mentioned?
Oh, that's a tough question. It's something that's still being investigated. Why do our babies, why do they have congenital heart disease? And right now, in simplest terms, it's just an accident. It happens in the first 8 weeks of their pregnancy. They may not know they were pregnant, and something happens, exposure to something, a drug intake, radiation. We're not sure. But in the future, I'm sure we'll find an answer to that.
So there's no need for people to worry or the parents to blame themselves?
Definitely
there's no
not.
reason.
Yeah, there's no reason to blame yourself. It's just an accident.
Important thing there is to recognize it, because some conditions are life-threatening, as you mentioned.
Definitely. In baby Eder's case, we recognized her condition in a few hours, and we immediately started our work to help save her life.
Yeah, that's the thing, is you have to be able to diagnose it early and do something about it. Like in the case of baby Eder, you did a palliative procedure on her. Would that have worked with other babies for the same condition?
This is a condition wherein we open the small hole, the patent foramen ovale, in the upstairs rooms of the heart in order to make it bigger. And it only works for those heart conditions that do not have direct blood flow from the right side of the heart to the lungs. And baby Eder's condition, the blood vessels carrying the blood coming from the body with no oxygen returned it directly back to the body. So we needed that hole to mix. If the valve or the doorway going from the right side of the heart to the lungs is non-functional or atretic, it doesn't open, then we also need this procedure. And it is a palliative, it's a temporary procedure, it's life-saving. It buys us a lot more time so that we can actually prepare the family for surgery.
Wow, so it's a really a special case, and you really have to understand your patient, because if not, you wouldn't know exactly what you have to do. And so I know that going under the knife is always a risk for these children. And actually, I think a lot of parents would like to know, how much of a risk is it?
Oh, with today's technology, going for open heart surgery is about 5 to 8% risk, all in all, taking all consideration. But when you're dealing with, in the condition of baby Eder, a very sick baby, lacking in oxygen, and our skill currently in the country, the success rate is about 70%. So that puts it at a 30% risk, which is much, much higher than the normal run-of-the-mill ventricular septal defect open heart surgery. So it's still quite high, but it gives you or gives the family a chance to have life for that child, a full adult life.
Well, my son also underwent an open heart surgery
Yes.
5 years ago, and it was a very trying time in our lives.
Trying,
It was,
stressful time, right?
Stressful, yes. And in your case, I mean, how do you explain to parents how complicated this surgery can be and the risks involved?
It's very difficult. There's no simple answer. No, each family is approached differently. In Berna's case, when I first spoke to her, she did not have her husband with her, had her parents with her. So
Yeah.
I gave it in piecemeal. I gave them a broad idea of what the problem is. Then I started explaining it slowly. But, you know, knowing the stress, you have to emphasize that almost all these congenital heart diseases can be fixed. It will take time. It may take a lot of money. But the bottom line is we can do a good job. You know? We can really fix these hearts.
So you mean even the possible side effects of the surgery or the procedure is explained or
Yes.
told to the parents?
Oh, definitely. Every detail, possible complications from the most severe would be losing the child, the most minor, bleeding or infection. So everything is laid out, and we try to test them to make sure they really understand. And it's hard to understand and remember everything we're telling them if
Especially
you're
if
under
they're
stress.
scientific terms.
Yes,
Yeah.
oh,
Diba?
definitely. And if they're under a lot of stress and emotional stress in her case.
So how do you test it if they do understand before you, of course they sign a consent, but how do you, that's not just enough. Like, you need to know that they understand the complications and...
I try to ask them to try to give back a little bit of what I said. If they
Okay.
understand why we need to go for surgery, they understand the risks. Okay, so they'll enumerate most of it. But with each visit, I also reiterate, re-emphasize everything all over again. So a well-educated parent and family is the best help to the doctor. They can make very well-informed decisions that way.
Before the show, you talked to me about being in a team and the parents being part of the team. And in my case, I really appreciated the fact that I was part of the team because it helped us understand the case of my son and understand how we can help in making him better,
Yes.
sooner.
Yeah.
So, you know, I mean, years after an open heart surgery, what can possibly threaten a baby?
Oh, in most open heart surgeries, the most common will probably still be rhythm disturbances, the irregularity in the heartbeat from the scars created by the surgery. But these will probably show itself probably in the adulthood. So when they become adults or elderly patients themselves, it will be a little more prone than the general population. Specifically for either's case, when we did the surgery, the most difficult part that gives it a high risk is the transplanting of the coronary arteries. Those little blood vessels that give oxygen to the heart itself. We have to move those. So those are about 2 or 3 millimeters.
Those are tiny.
Tiny, and then they have to be transplanted to the new site. So they can get kinked or stretched too much, and that actually leads to problems in the recovery. But if it's done well, they survive quite well. No
Pala
other
pwede mapasma yung kamay nito.
Oh, but you have to understand, I'm not the surgeon.
Very
I'm just a team. So
Oh, yeah,
actually,
that's
part of the
right.
team, yeah.
I'm the face of the team, right? So we have surgeons, anesthesiologists, and intensive care doctors working with me to take care of patients like Ida.
So baby Ida recently celebrated her first birthday. So are you happy about her progress?
Oh, definitely. She's no longer just a cardiac patient. She's just a regular pediatric patient. She's growing well, achieved all the milestones, and they celebrated their birthday. They went to a government institution to give food to the charity patients. So in thanks.
To give back.
Yeah, to give back.
Is she still on any other form of treatment?
No,
like
she's not on any medications. I will do ultrasound of her heart just to monitor her, but she's doing very, very well.
Coming up after the break, we'll talk more about pediatric heart conditions, and Dr. Cheng will also answer questions from our studio audience. Keep it here. Talk to Doc will be right back.